Early detection is vital when it comes to cognitive impairment, with a number of ways available to help our senior community protect their cognitive function. Joining me this morning is Chief Medical Officer of Signify Health, Dr. Heidi Schwarzwald. Dr. Heidi, good morning.
Good morning.
Well, we want to start off here with what might some of those symptoms that family members and caregivers should really be looking out for when trying to determine if their loved ones may have some cognitive issues.
Yeah, a huge number of older Americans don't realize that they're having mild cognitive impairment, up to 92%. And sometimes the changes can be really subtle and they can be really scary for the person experiencing them. They're worried about losing their independence. As family members or friends, we want to look for some of those changes, such as, are they forgetting their medications when they hadn't done that before? Are they missing social events that they wouldn't have otherwise missed? Are they having trouble following directions or following a conversation? Or you might even see an increase in falls.
Yeah, and as far as sort of detecting those symptoms, in the same vein, why is it important to get a head start on detecting that cognitive decline or impairment?
Yeah, it's really important to have your cognitive function tested every year, just like you do for other health diseases. That way you have a chance of either slowing the progression. There are some treatments that are now available if you detect certain types of illnesses early, or just making changes in what you do every day can really help slow that decline. Not catching it can put you at risk for hospitalizations, increased depression, other problems as well.
Well, the big question lies, are there any ways to possibly prevent or just maybe slow down cognitive decline?
Yeah, surprisingly, one of the best things you can do is learn something new, whether it's learning to dance, sew, woodworking. If you like doing word puzzles, try number puzzles instead, or even learning a new language. The more you keep your brain active with learning new skills, the better it preserves the things that you already knew.
Well, for our viewers watching who might, who may be looking for additional help in this sense, how can they book an in-home health evaluation with Signify Health?
Sure. Signify Health will send a nurse practitioner or physician assistant to your home. They'll do a full assessment as well as a digital cognitive assessment. It's really like playing a game, but it gives you a chance to understand where your cognitive function is today. Those results will then be shared with you and with your primary care provider. And getting that done every year helps you track how you're doing. These visits are available to you at no cost to you by calling the phone number on the back of your health insurance card or checking hellosignify.com.
And before we go, do you have maybe any tips or advice for families dealing with this currently or may feel like they might be there already?
Yeah, it is a very hard thing to deal with. It really changes dynamics in families as someone older is having cognitive decline. I would say the most important thing to do, especially as we get into the holidays, is don't avoid the topic. Broach the topic, start to have the conversations so that everybody can start to plan for what's coming next so that your loved one can live independently for as long as possible.
Well, Dr. Schwarzwald, thank you so much for joining us this morning.
Thank you.
For more information or to book an in-home evaluation, just visit hellosignify.com.